Hi guys, Heather here. So back when I was a new nurse, and last week, no, I'm just kidding, not last week, but I always wondered how I would handle an unstable situation, like a patient having chest pain or shortness of breath, without freezing up and forgetting what I was supposed to do. And those were two of my biggest fears. But after having experience as a cardiac nurse, this is how I handled a patient who had chest pain 3 times during my shift. So one morning, my patient calls me into her room and rates her pain as 8 out of 10 in her arm, jaw, and chest, describing it as a squeezing or a tightness. I turn her oxygen up to 4 liters, I take her vitals, and her blood pressure is like 156/86. And I give her a nitrosublingual tab and 2 milligrams of IV morphine, and then I get a stat EKG. The doctor is already on the unit, so he comes in and talks to the patient. Within 5 minutes, her chest tightness is gone and her BP drops to like 103/68. So the doctors wanted to put her on a nitro drip and titrate to keep her systolic blood pressure above 90. And nitro is a vasodilator, so it helps open up those blood vessels to improve blood flow and oxygen to the heart. So I started the drip, and within 45 minutes, I turned it off because her blood pressure was like 80s/50s. She was asymptomatic. She didn't feel lightheaded or dizzy. We repeated this scenario another 2 times during the day, and she was already scheduled for a heart cath the following day, so that was that. So, next case. If your patient calls you into the room with shortness of breath, try not to panic and hyperventilate, or you will become short of breath yourself, and then you guys will both need help. The first thing you want to do is check their pulse ox to check their oxygen levels. Sometimes their oxygen saturation levels will be within normal limits and the patient's maybe a little anxious, or maybe they overexerted themselves walking back from the bathroom and they're having a hard time catching their breath. But if their oxygen saturation is below 92, we ask them to take some deep breaths and see if that helps raise their levels back up to normal. If not, we can always put them on a couple liters of oxygen. If they're already on oxygen, we can raise the oxygen liters up to 5 if they're on a nasal cannula. But if you have a patient with COPD, acceptable O2 levels for them can be 88 to 92. If the patient isn't really responding to the oxygen, I would call respiratory and have them come assess the patient. They might need to be put on a simple mask that can require administration of oxygen greater than 5 liters. Maybe they need a respiratory treatment if they have them ordered. And if the patient isn't getting better, then we can call the doctor. So that is the basic routine care for chest pain and shortness of breath patients. Thanks for watching. I'll talk to you later. Bye.